Why did I choose OHSU? I don't really, well, it's kind of tough. I think it was really just a gut feeling. I'm from the Northeast, and so most of the programs that I interviewed with were from the Northeast, and like, you know, some really excellent places. But when I came out here for my interview, it was just like such a good gut feeling. I loved the city. I really loved the residents and the faculty. I think, you know, I had a feeling they'd be like amazing to learn from and work with. I think I was right. So just went with my gut.
The people. I was fortunate enough to do an away rotation here, and I liked everybody I met.
I did an away rotation here, and I felt like this was a great combination of like really fun personalities to work with, people who are really invested in teaching, and specifically in, you know, not just getting you through a surgery, but making sure that your surgical skills evolve, and also your clinical skills. And I really liked the residents in general too. So it felt like a place where I would get a good amount of autonomy from an early on time period, and also be able to grow as the residency progressed, but with a good amount of supervision that would make me more successful.
If you look at the main, textbooks of otolaryngology, Cummings, for example, our chair, Dr. Flint, is one of the editors of that. The department has also authored many, textbooks of its own, from surgical atlases to podcasts to, many other contributions to the field. And so I think when you come here, you're really learning from the leaders of otolaryngology. And so you won't find that kind of training really anywhere else.
I loved that there was a large dedicated block for research. I felt that that was a very rare thing whenever I was looking at different programs. Often there are like a couple of months here and there, which I feel like isn't really feasible to do real research during such a short amount of time, and we have a very large dedicated block to that that's very well supported. And we also, whenever I was interviewing here, I felt like the people got along really well. There was a lot of camaraderie. People were definitely friends, not just coworkers, and that was really important to me.
Faculty and the residents really interacted in a way together that I hadn't seen before, where there's this mutual respect as well as collegiality between the two groups. That the attendings are definitely the teachers and the bosses, but they're not. The residents aren't afraid to kind of jump around with them and have a good time, and not always afraid of everyone. So
I can definitely say at OHSU we get wonderful hands-on surgical training that I think is unparalleled. We get a lot of autonomy and a lot of room to grow in our learning process. And our co-residents, I think we have a wonderful relationship with each other. We're a big, giant, tight-knit family, and COVID has been the hardest thing, trying to keep us socially distanced, because that's not what we would prefer to do. We're usually all hanging out with each other and going out together and doing different activities. And so I think the mixture that we have both between our resident relationships and our attending relationships make OHSU a very special place to train within Portland, which is a wonderful city to live in.
Knowing that I wanted to be part of a group of people in residency that really valued teaching and really wanted to give back to future years of residence.
Actually happy to find that the faculty that I met here, they're the same as when I met them on interview day. They're just such great teachers, just very supportive people, starting with our program director, Dr. Wax. And all my interactions have been so amazing, not only with the faculty, but also the other residents thus far. Also, the curriculum here is very much geared towards resident education, and is also very highly operative, and provides a very, very good foundation for your career beyond residency.
I really enjoyed my interview day, and the attendings were great, but meeting the residents, I think especially solidified it for me. Everyone just seemed really happy and to get along really well, which was really important to me. The post-call days, having in-house call with post-call days is amazing. It really allows you to either rest or do life things like go to the dentist.
I also just really enjoyed the atmosphere and the people, so I think that's why I came here.
We have subspecialty representation across all disciplines of ENT. We have multiple hospitals, including a VA, a children's hospital, an academic center, and we rotated a number of community hospitals around Portland. I think overall we just come out of residency very well prepared for either private practice or going on to very strong fellowship programs all over the country. Secondly, I think Portland's just a great place to live. I think it's got good access to the outdoors. It's a very livable city. And third, I think the residents here are overall happy and I think feel very well supported by our department in particular, and also by the greater OHSU hospital.
I think that the location of Portland is wonderful with access to the outdoors, great food, a lot of arts and entertainment. But really, I did a sub-I here, and I loved the way that the residents interacted with each other. They were all clearly so close, spent a lot of time together, and had a great relationship with their attendings and faculty, which is so key when you're learning difficult things, to be able to feel like you really have a collegial relationship with the people who are teaching you. And I think that creates the best learning environment and would make me the best surgeon I could be.